And now I'd like to introduce President and Founder of Americana Safety, Dr. Joseph DeMaria.
Good morning and welcome everyone to Safety First, the Importance of Workplace Safety webinar. Americana Safety is pleased to partner with the Chamber to do this presentation. Americana Safety is a nationwide consulting and expert witness firm headquartered here in Las Vegas. We have offices in 15 states throughout the country. And we're pleased that we were awarded the prestigious 2015 Business Excellence Award by the Chamber this past year. Today's agenda will cover 6 items: creating a safety culture, understanding federal OSHA, Nevada OSHA requirements, employer and employee responsibilities, record keeping and reporting workplace injuries, and sources where you may get assistance. Creating a safety culture. Its importance of workplace safety begins here. Creating a strong management leadership team, ensuring employees are engaged in workplace safety, monitoring their performance, having safety systems in place such as performing a job safety hazard analysis, ensuring safety regulatory compliance, and all that will add up to increased market share and a favorable customer perception of your business. So without a good, strong safety culture, we're inviting an accident to happen. Some businesses really don't care that much for safety, and they don't care if they get caught not following the safety rules. Others are reactive and usually do lots of safety stuff after an accident has occurred. Those that have safety systems in place to manage the hazards we call calculative, whereas those who are proactive work on unsafe conditions as soon as they're found. But it's best to be in the generative type, where safety is built into your structure, the way you work and think about performing your job. If not managed correctly, you can see that a safety culture can go downhill very, very fast. Some of the benefits of having a good safety culture in your business is where the business exemplifies that safety culture and everyone feels responsible for safety and pursues it on a daily basis. Employees then go beyond the call of duty to identify any unsafe conditions and behaviors and then intervene to correct them. Employers with a good safety culture typically experience few at-risk behaviors, which in turn gains many benefits. For instance, low incident rates, which would equal reduced workers' comp rates and costs, low employee turnover and absenteeism, which has indirect and direct cost savings, and the benefit of higher productivity, which equates to higher income and profitability. So you can see these businesses are generally very successful in all aspects of their business by having a strong safety culture, and that in turn gains them a greater market share and the opportunity to expand and grow. Understanding federal OSHA. The Occupational Safety and Health Act of 1970 created the Occupational Safety and Health Administration, as we refer to as OSHA. OSHA is an agency of the U.S. Department of Labor, and its mission is to assure the safety and health of America's workers by setting and enforcing safety standards, providing safety training and outreach and education, establishing partnerships with many industries, and encouraging the continual improvement in workplace safety and health. Nearly every working man and woman in the nation comes under OSHA's jurisdiction. Has OSHA made a difference? Yes, it has. Since 1970, OSHA has helped cut work-related fatality rate in half. They've worked with employers and employees to reduce workplace injuries and illnesses by more than 40% and have virtually eliminated brown lung disease in the textile industry. OSHA has also reduced trench and excavation cave-in fatalities by 35% and protect more than 93 million workers employed at more than 6 million workplaces nationally. Workplaces are much safer as a result of government safety regulations than they would be if business was left to its own devices. So what exactly does OSHA do? It encourages employers and employees to reduce workplace hazards and implement new and improved existing safety and health programs. It helps develop and enforce mandatory job safety and health standards, provides assistance, training, and other support programs to help employers and workers. OSHA also maintains a reporting and record-keeping system to monitor job-related injuries and illnesses, enforcing compliance through notice and no-notice workplace inspections, and penalizes those employers with citations and fines for non-compliance of OSHA standards. So who is covered? OSHA covers most private sector employees. Coverage is provided directly by federal OSHA or through an OSHA-approved state program. The state of Nevada is one of 8 states that does have an OSHA-approved state plan. OSHA does not cover the self-employed or immediate members of farm families that do not employ outside workers. Here's what OSHA requires. For employers are required to determine which OSHA standards apply to their specific industry and to their business. They are also required to read and understand the OSHA standards that may apply to their industry and specific occupational job tasks. For many, this is where they become vulnerable, for not fully understanding the specific regulatory requirements and the specificity of what may be required within those standards. Employees are required, although, to comply and enforce those OSHA standard requirements that apply to their business operation. Here are the most common OSHA standards, which are 29 CFR, that's codified federal regulations, which are labor standards. Part 1910 applies to general industry. Part 1926 applies to the construction industry. OSHA's top 10 most frequently violated standards for fiscal year 2015. These are cited violations following inspections of workplaces by federal OSHA. In the left column, numbered 1 through 10, are the standards that are violated, and in the right column, the exact reference for that OSHA standard. Fall protection has been in the number 1 place for many years, and that applies to the construction industry. Second one is hazard communication. This is for general industry. This is where workers must be advised of any hazardous chemicals or substances that they work with and the protections necessary for their safety and health. The third one is scaffolding, and that is in the construction industry. Number 4 is respiratory protection, where workers must be provided respiratory protection when working around hazardous substances and chemicals. The number 5 is lockout, tagout, and that's an electrical requirement. When maintenance workers are working on equipment, they must ensure that that equipment cannot be re-energized while they're working on the equipment, and they do so by locking it out, actually putting a lock on the circuit breaker and tagging it out with their name and usually a photo on the tag. And so it cannot be re-energized while they're working on the equipment until such time as they're completed with that task, and then they unlock the circuit breaker and then re-energize the equipment. Number 6 is powered industrial trucks, and that covers anything from forklifts to bucket trucks to scissor lifts, and that is under the general industry standard. Number 7 is the use of ladders in the construction industry. Number 8 is wiring methods in general industry. Number 9 is machine guarding, which has traditionally been in the top 3, but now has dropped down to number 9, and that's where machines must have guards in place to protect the workers from getting their clothing or parts of their body into moving machine parts. And lastly is general requirements for electrical. OSHA will increase fines effective August 1st, 2016. And they'll increase these fines by about 80% for the first time in a quarter century. This would mean the maximum penalty for a willful violation would rise from the current $70,000 to about $127,000. A willful violation is where a company has the knowledge and the records, where they know what the standard is and what should be expected of them, and where they have willfully violated that standard. Now on to some Nevada OSHA requirements. As mentioned earlier, Nevada is one of 8 U.S. states permitted to administer their own job safety and health programs, or state plans, if they meet the minimum federal OSHA requirements, which the state of Nevada has. The state plan and its programs must be at least as effective as the federal program. It could be more stringent, but not less effective. In Nevada, the law requires businesses to develop and implement a written workplace safety program if the company manufactures explosives or has 11 or more employees. That written workplace safety program must be properly developed, maintained, and its contents enforced by the employer in order to be effective, or be subject to Nevada OSHA citations and fines when they are inspected. Next, we'll cover employee and employer responsibilities. The key points for employers are that they provide a work environment that's free from recognized hazards that could cause harm to their employees. Employees are required to comply with all OSHA standards, rules, and regulations for their industry and particular business. Employees are required to routinely examine workplace conditions for compliance with OSHA standards in their business or industry. To ensure that employees are equipped with safe tools and equipment for the purpose of performing their jobs in a safe manner, and that those tools and equipment are properly maintained. Employers are also responsible for providing employees with all required personal protective equipment, such as hard hats, eye and face protection, work gloves, hearing protection, etc. They're required to maintain OSHA-required records of work-related injuries and illnesses utilizing OSHA Form 300. They must also designate a competent person to provide any required employee safety training or to contract with a professional safety consultant to provide that training. Next is listed OSHA's definition of a competent person. It is one who is capable of identifying existing and predictable hazards in the surroundings or working conditions, which are either unsanitary, hazardous, or dangerous to employees, and who has authorization from the employer to take prompt corrective measures to eliminate them. Next, employee responsibilities. Here are some key points that employees are required to do. Like their employer, they must comply with all applicable OSHA standards at all times. Follow the employer's safety and health rules and policies and safe work practices. Wear all personal protective equipment and clothing required for the job being performed. Immediately report all safety violations or potential hazard conditions to a supervisor or a safety committee member if they have a safety committee in their business. Report all work-related injuries and illnesses to a supervisor. For instance, if the worker gets injured on Friday and they think it's minor, they should still report it to their supervisor and not wait until Monday, because it would be unknown to the employer if it actually happened during work or on the weekend. They're also to report hazardous conditions to OSHA if employers do not fix them. And they will cooperate with OSHA inspectors once they come on board to do a notice or no notice inspection. Employers have certain rights. They have the right to identify and correct problems in the workplaces, working with their employers whenever possible. and they have the right to complain to OSHA about working conditions threatening their health or safety in person, by phone, fax, mail, or electronically through the OSHA website. Section 11C of the OSHA Act gives workers a right to seek a safe and healthful conditions on the job without being disciplined or the fear of being fired. This is also covered under the Whistleblower Protection Act. Next, we'll look into record keeping and reporting. Employers of 11 or more employees must maintain records of occupational injuries and illnesses on the OSHA Form 300. These work-related injuries and illnesses are considered recordable injuries, which would include the death of a worker. Workers have days away from work as a result of a workplace injury or illness. They're placed on restricted work or restricted duty, where they receive medical treatment beyond first aid, or an employee suffers loss of consciousness. The next form is the summary of work-related injuries and illnesses. This is the OSHA Form 300A. From the previous year, this form must be conspicuously posted in the workplace from February 1st through April 30th. Here, this will be a composite of what is recorded on the OSHA Form 300, but without listing the employees that were injured by name. So it will be a compilation of the number of cases, the number of days away from work, the number of days of restricted duty. So basically an overall compilation of that summary from the previous year. Fatality and injury reporting. Here's an interesting chart on the historic revisions for fatality and injury reporting by OSHA. You can see in 1971, fatalities or the hospitalization of 5 or more employees had to be reported to the nearest OSHA office within 48 hours. And that significantly changed in 1994, where they reduced the hospitalization numbers from 5 to 3, and the reporting requirement from 48 hours to 8 hours by phone to the nearest OSHA office. In January 1st, 2015, it changed dramatically again. They separated out fatalities from the others. Fatalities must be reported by phone to OSHA within 8 hours, and the hospitalization reduced from 3 down to 1 or more employees, or employees that suffered an amputation or loss of an eye, to be reported within 24 hours, either using by phone or OSHA's new Access web portal. Now you see the double asterisk there on the fatalities and the others, and that means that the clock starts from the time you were notified. As an example, if a worker was fatally injured at 6 o'clock in the morning and you weren't notified until noon that day, you have 8 hours from the time you were notified. So by 8 p.m. of that day, you must notify OSHA. Likewise, for those that were hospitalized or any amputations or injuries such as loss of an eye, you'll have 24 hours from the time you were notified. So in that example, you would have by noon the following day. The final injury and illness record-keeping rule, the impact of this rule is that state plans must adopt it. There will be a sharp increase in reports to OSHA, which we anticipate there will be approximately 100,000 or more reports. Those more reports will equal an increased number of OSHA inspections, citations, and eventual fines. OSHA will publish severe incident reports, which I call public shaming policy, and these are reports where there's been a number of deaths or severe injuries coupled with willful violations. So companies that fall into that category will be publicly shamed on OSHA's website. So that's something very new. Here's some sources of assistance. There's the OSHA federal website, and that's osha.gov. There's the OSHA Training Institute, and they have outreach training programs. In the state of Nevada, we have SCATS, which is the Nevada Safety Consultation and Training Section. Other sources of assistance include professional safety consultation services, such as those provided by my company, Americana Safety. Other safety organizations that partner with OSHA include the National Institute for Occupational Safety and Health, NIOSH, the American National Standards Institute, ANSI, which greatly works with and in partnership with OSHA to give more specificity to the OSHA standards in a variety of areas. Next is the Environmental Protection Agency, EPA, and the National Fire Protection Association. The National Fire Protection Association puts out very many standards, most popular of which is their Life Safety Code. Here in Clark County, the Life Safety Code has been fully adopted. Other jurisdictions have the ability to adopt all or part of the NFPA's Life Safety Code. Well, that brings us to the end of our presentation for today on safety first and the importance of workplace safety. It is my hope that you've gained a better insight into what's required of you and your business for protecting your workers. And here are my contact information, email, our corporate office phone number, and our website address. And I'd be more than happy to answer any questions that you may have by either of those methods. Again, on behalf of Americana Safety, I want to thank you for participating in today's webinar.
I just want to open the floor up to any questions that you might have. Again, if you want to ask a question, you can type it into the chat box in the bottom left corner of the screen. I just have, I think, two questions. One, what is the financial incentive for employers having a top-notch safety plan in their business?
Well, there are many financial incentives. There's indirect cost savings and direct cost savings. When the workers get hurt, other people have to pick up the slack. They may have to hire additional workers. They may have to retrain other workers. So those are some important indirect costs. The direct cost would be the increased workers' compensation cost because their rates will go up. So it's very prudent for employers to make sure that they have the best safety program out there possible to protect their workers, not only from a caring standpoint, but also from a financial standpoint as well.
And then it looks like we have a question coming in. Is there a safety organization here in Las Vegas that businesses can join?
A safety organization here in Las Vegas, I don't know if there is the American Society of Safety Engineers has a local chapter here in Las Vegas. So that's generally reserved for the safety professionals that work for those companies. And you must be a member of the American Society of Safety Engineers to be a member of the local chapter. If your company has such a person, then that's a great resource that they can bring back to the company.
And then also, in terms of the record keeping and the reporting, are there any fees for the forms, and where can members go to get the forms?
Oh, there's no cost at all. OSHA is it's a public organization, and so anything that's out there is in the public domain. They can go onto the OSHA.gov website. They can download the OSHA Form 300, which comes attached with the 300A, which is the summary, end of year summary, and they can print that directly. So there's no cost at all for getting any of the OSHA forms.
Can Americana Safety initiate organizing a safety practitioners organization for all the safety professionals in Las Vegas?
Can we initiate organizing a safety practitioners organization? Well, we do partner with a lot of companies, and we're in constant contact with our colleagues in the safety profession to talk about ways that we can overall help improve the company's position. Of course, we do perform safety audits of companies, and we do a free initial safety audit in order to do a more detailed proposal. But we do work closely with all businesses nationally and, of course, locally here in Las Vegas.
Well, it looks like we don't have any more questions. So, again, if you guys want to ask any more questions to Dr. DeMaria, you have his information up on the screen. We can always send you this presentation if you want to pass it along to other people in your business. I want to thank Dr. DeMaria, again, thank you so much for joining us, for hosting this webinar today, and also thank you all for coming. I just want to remind you all that another Chamber U is next Friday, and we're going to be talking about fraud prevention and protection with the Las Vegas Metro Police Department. So again, if you have any questions, please direct them to Dr. DeMaria or to the Chamber of Commerce, and we look forward to seeing you next week. Thank you.